The World Health Organization has praised China's attempts to contain the coronavirus. The country was quick to seal off Hubei province, where the outbreak began, closing factories and banning travel, and the impact is clear. This shows the daily new cases in Hubei since the beginning. The numbers that were once in the thousands are now in the hundreds. And the strict quarantine measures have stopped the virus spreading to the rest of China. Numbers there are comparatively low. But the virus did spread abroad, slowly at first, but now, as this line shows, the growth in daily cases is much larger outside China. That comparison is even clearer when shown as a proportion of new cases over the last 3 weeks. China makes up a dwindling share of the total. In Europe, the main focus is Italy, which has at least 8 times the number of cases of any other EU country and a fatality rate of 3.2%. Well above the global average of 1%. One reason could be that almost a quarter of Italy's population is aged over 65, and the elderly are, of course, at the highest risk of serious disease. Researchers at Imperial College London think underreporting of mild cases could also be a factor. Officially, there are just over 2,500 cases. But the real number could be between 50,000 and 100,000 because so many people have mild symptoms, and taking that into account would bring the fatality rate down. Italy has, though, exported the virus to a number of countries, including Spain, where, as of lunchtime today, at least 18 of its 198 cases had travelled to Italy. 18 of Sweden's 35 cases can be traced to the country, and at least 22 of the UK's 87 cases were imported from there. The outbreak in the UK is several weeks behind Italy's, but we do now have person-to-person spread, and the concern is we may soon have an epidemic here.